Hello and welcome to Sunset Television. I am Vishal Dahiya and you're watching our special show India Fights Back, where we talk about the battle against COVID-19 pandemic. Now recently, a rising trajectory of daily new cases is visible in 8 states, that is Maharashtra, Tamil Nadu, Punjab, Madhya Pradesh, Delhi, Gujarat, Karnataka and Haryana as well. We're going to try and understand not only the reasons behind this recent surge, but also as to what needs to be done on the ground to tackle this particular surge. And this is going to be really important and significant now that the things are mostly back to normal, and we need to understand a lot of aspects of trying to contain this particular surge. The battle is not yet over out there, and to understand much better, we have with us two distinguished experts. Let me first introduce them to you, beginning with Dr. Samiran. Panda is a member of the NEGVAC and head of the ECD division of ICMR in New Delhi. We're also joined by Professor PVM Lakshmi, professor of epidemiology in the Department of Community Medicine and School of Public Health in PGIMER, Chandigarh. Welcome, both of you, to Sunset Television. And let me begin with you, Professor Lakshmi. Let's start by understanding what's the situation on the ground, since Punjab and Haryana do figure in that list of 8 states where we are experiencing this rising trajectory.
Yeah, like if we look at it, like from the last week of January, they started a slight increase, and right now Punjab, especially, there are 3 or 4 districts which are actually showing the highest rise, even in Punjab. Mainly in Punjab, if we look at it, the Kapurthala, Hoshiarpur, Nawashahar, and Jalandhar to some extent are the ones which are mostly affected by the rising trend. And similarly, Haryana is slowly picking up in the number of cases, and it is increasing, and they're reporting about 1,500 cases per day.
Okay. So that's the state. They are in these 2 specific places, that is Punjab and Haryana. Professor Dr. Panda, rather, I'd like to bring you in here, and the situation seemingly is a bit more serious in states like Maharashtra there, if you're looking at, even in Karnataka and other states like Madhya Pradesh, Gujarat, Tamil Nadu, they also have almost similar trajectory as we are witnessing in Punjab and Haryana.
Yes, and I would say that if one compares the numbers from these states, for example, Maharashtra, which was the scenario in December, and the scenario that we are in now, or the scenario that we are witnessing, clearly one could say that the gain over the last 2 months, which is January and February, have now been lost. So basically, we are witnessing the reversal of gain, and that's certainly a concern. And are these going to be the phenomena in these 8 states, or these kind of phenomena could also happen or occur in other states? If that is the question we ask ourselves, I would say yes, it's quite possible that other states would also observe the same. But the fundamental question is, why so? The answer is in the science of it. The virus, SARS-CoV-2, which causes COVID-19, has not changed its strategy in terms of transmission. It still gets transmitted through the infected water droplets or aerosols, while an infected person talks or sneezes or coughs, and he or she is surrounded by others who are susceptible. So if that's the case, which still exists, and we create an environment, then we do expect the transmission and this kind of surge. So what I would say that coronavirus doesn't come and infect someone if the virus is not invited. So if we create an environment where we are allowing the virus to spread, it would spread. And the third thing that I would highlight is that the latest national serological survey, which got completed in early weeks of January, that clearly underlined that 75% of the Indians were, uninfected and unexposed. So they were vulnerable to infection. So given this situation, we should not be, surprised at all by looking at this upsurge or the rise in number, because there must be an environment which is facilitating it. Now, what are those events which are facilitating? One could be the opening of schools and colleges or the malls. Second is the, political campaign, election campaign related gathering. Third, it could be religious reasons for which we are, creating a conducive environment for the virus to spread, or it is due to events, social events like marriage ceremony, where people do come and lower their guards down. So if those are the situations in which the virus can spread, it would spread, and that's exactly what is happening. And some of the states which would see this election campaign is now going on, and if some more, mixing happens, one would not be surprised to see similar kind of surge in other states as well.
Okay. Let's also hear it from Professor Lakshmi here. Professor Lakshmi, Punjab is one of the three states which cumulatively account for a majority of this surge in cases. So, how would you respond to the why of this surge?
If we look at it, why cannot be a single factor? We cannot point out to one single cause why there is a surge. There are multiple factors which are acting together. Like when we say why there is a surge, one is when we are unlocking has started. Slowly we have removed the restrictions. And in Jan, we were witnessing very few infections. Like even few of the districts, they have reported 0 cases on some of the days. So people have become complacent. They thought that the virus is over. That is why the restrictions are being lifted. And once completely the restrictions are over and the schools have been opened up, there was an intermixing of the people. And then earlier we used to have a restriction on the social gatherings, where we used to have around restricted to 50 to 100 people. Now there was no restrictions for marriages and other social gatherings. So people were intermixing. There is a lots of travel happening between the urban pockets and the rural pockets and the peri-urban areas. And at the same time, the complacency has set in where people have stopped using the mask. If you look at it in Punjab and if you travel, you hardly see anyone who is wearing a mask. Most of the people, they don't wear a mask. So this is use of masking has come down, and then the restrictions have been lifted, and there is a lot of intermixing of the people. And the schools have opened up, and there are municipal elections which had gone where there was large number of gatherings were there, and there was religious congregations happened during the same time, like Guru Ravidas Jayanti and all. So all these things, they come together, and it was a mixture rather than, I cannot say it's only one thing which was led, but it is many things happening together at the same time, and accompanied by decline in following the or compliance to COVID appropriate behaviors, which had led to the increased rise in cases. Though this surge is expected, but it was a bit more than expected.
Okay, definitely COVID appropriate behavior is one of the reasons which has been pointed out by experts time and again, and both of you are pointing out to the similar aspect. Now, before we move on to understand what needs to be done on the ground and what exactly is being done right now, let's also understand one more aspect here and try and figure out as to how much is that factor responsible. I'll start with you, Dr. Panda, because earlier when there was a rise in cases reported in late December and January as well, some places also reported some mutants of the SARS-CoV-2 virus. So in this particular scenario, today when we are talking about this rising trajectory, what's the percentage of that factor here? Is that actually a factor, or is just the COVID appropriate behavior which is the reason? And then what's the status on the mutant strains of SARS-CoV-2?
Vishal, that's a very good question. And what is a mutant, before we get to the deeper or take a deep dive in this issue? So while the viruses proliferate, particularly RNA viruses, they do go through small little changes, which are called drifts. And when the change is quite big or noticeable, then we call them shift. And that is normal and that is expected, because the viruses are proliferating and the changes are happening due to the process of proliferation or under the immunological pressure. So that's nothing unusual. It's known to happen. Now, while the viruses change, they do change for their own benefits. What is it? The benefit for a virus would be its ability or increased ability to be able to go from one person to another, because that actually offers an opportunity for the virus to spread and increase in number. So there is a survival advantage for the virus, or the transmission advantage for the virus through those mutations. And at the same time, the same virus might not be necessarily deadlier, because if the virus kills me, then the virus actually is defeating its own purpose, because the dead person doesn't talk or sneeze or cough. So it is a survival advantage which the virus acquires through mutation. Okay. Now, some of the mutants have been linked. For example, in UK, the UK variant was linked with outbreak in a very local situation, or a focal outbreak due to the new mutants, or the UK variants, as it is called. But the point is, be it new mutants or be it the old circulating strains, they spread through the same route of transmission, that is the infected water droplets or aerosols. So what I would say that from public health perspective, we should focus on the behavior. Of course, biology is playing a role. So what we are talking here is the biology and the behavior. And the biology of the virus, yes, there could be mutations. Yes, some of the mutants could be more transmissible, but that does not immediately get into or push us into a phase of panic that, oh, there is a new mutant, so we are kind of helpless. We have nothing to do because it is the biology which is going to overpower us. That's wrong. The new mutant, or be it the old circulating strains, they spread the same way. So behavior and the behavioral modifications are going to actually play a big role in addition to the vaccination drive that is happening. So if we start talking about what should be done on the ground, as you said, as you asked very rightly, we have to consider that it's biology, but biology is not going to overpower because it's the same route of transmission. So the behavioral modification needs to happen. In addition to that, the vaccination drive needs to be ramped up, or need to be probably doubled in the speed, from the speed in which that's going on now.
Okay, we'll come to that aspect as well. And the vaccination part, you rightly pointed out, Dr. Panda, that becomes really important. We'll try and understand those numbers also. But let me first bring in Professor Lakshmi here also. On the mutants, on the variants part, Professor Lakshmi, what's your experience there on the ground in those parts specifically? What's the situation there?
The genotyping has been done for a few of the samples which have been sent from Punjab, but there was huge strains, like mutant strains were not so common, and I think there was only one sample which was tested for mutant strain, but that doesn't come from the area where the pockets we are seeing, the high transmission pockets are seeing are the hotspot areas. So I don't attribute this surge of cases to the mutants currently until and unless the evidence builds up more, because they're sending more samples for genotyping, especially from the high transmission pockets. Unless we have a strong evidence, I can't say it is a mutant which is responsible for spread of the infection, especially in Punjab or in Haryana. But yes, the behaviors have come down, and I strongly feel that the behaviors are more important. Like even if it is a mutant strain, if we are following COVID appropriate behaviors, the chance of spreading the infection will definitely come down. So until if it is a mutant or a non-mutant, the behaviors are more important rather than the strain itself. Strain is important, but at the same time, the other things do play a role.
Okay, definitely. Behavior is very, very important, whether it's a strain A, strain B, or strain C out there. But as our experts are pointing out, there doesn't seem to be much of a correlation between, the mutants or the variants of SARS-CoV-2 virus and the recent surge which we are witnessing in these 7 to 8 states in the recent past, that is 24 to 48 hours. Dr. Panda, I'd like to bring you in here, and let's now talk about, as you've been pointing, and Professor Lakshmi has also been saying that it's the behavioral aspect. We will have to bring that behavioral change. And everybody from the government to the experts to us as well, we've been trying to drive home the point for almost a year now that it is basically the onus lies on individuals, and it is our responsibility to not lower the guard here. So what is it that you would suggest in terms of actions which need to be taken on the ground?
All right. So when we talk about the behavior, I would again say the behaviors not only in terms of the masking or maintaining physical distance during social interaction or maintaining hand hygiene, the vaccine-related behavior is also very important. So we still, unfortunate though, get to hear about the debates not only in the common people but in the policymakers, program planners, politicians about whether the vaccine should be taken or vaccination should happen. That's unfortunate, and those discussions and the debates unfortunately also influence people's behavior or add to the vaccine hesitancy. So I would say it is not only the other behaviors like hand hygiene, mask, and physical distancing during social interactions, but also vaccine-related behavior. For example, the hesitancy, that should also be addressed. And what are the determinants if we think about it? So we still cast doubts about the safety of the vaccines, which should not be. And then the benefits of the vaccines. And it's not only individual benefit, but also the benefits to the family members and benefits to the community that need to be highlighted. And finally, it's not just on the individuals or the community through the community engagement and community awareness campaign or in order to increase the confidence, vaccine confidence. But I would say that some part of the responsibility also rests with the state health authority and the state machinery, where we need to really speed up the vaccination. Because if we need to beat the virus in terms of its speed of transmission, the speed of vaccination should actually outwit the virus in terms of its rapidity with which it is spreading. So I would say it is not just individual or the community, but also the state health authorities who should try look into all the possible mechanisms by which the vaccination drive can be ramped up, and the current number of vaccinations should at least be doubled, if we really want to win over this, fight against COVID-19.
Okay. Professor Lakshmi, your views there on these two aspects, not only enforcing COVID-appropriate behavior, but also giving a push to the vaccination drive, as Dr. Panda is pointing out, because that is the best defense we've got so far.
One is vaccination definitely is very important, and especially if you are thinking of using vaccination to win the COVID-19, like right now we are looking only at the high-risk populations, that is more than 60 and below 60, we are looking at the people having comorbidities. But actually the transmission, if we look at it in the side transmission zones, is happening in the people who are below that age, who are more mobile. So maybe especially in these hotspots or high transmission zones, we might have to modify a little bit of our vaccination strategy. And we, especially if we have to have maybe around 60 to 70% people getting covered or protected either by natural infection or by vaccine, then we have to ramp up the vaccination in these, and maybe a little bit of change in our strategy depending upon the state specific situation or the district specific situation we might have to think in that direction also. Like if we really want to have this vaccination to give protection and to break the transmission chain currently.
Okay. That's quite an important suggestion coming in, Dr. Panda, there from Professor Lakshmi. And then this suggestion has come in earlier also. In the recent past, we've heard how the government of Maharashtra had also, sought permission to go ahead and vaccinate people above the age of 18 years in the district of Pune there. So do you believe that these kind of tweaks in strategies based on what's actually happening on the ground in the vaccination strategy is the best way forward there?
Yes, certainly. I would say that customization as the need be in terms of the expressed or felt needs and looking into the disease transmission dynamics and the epidemic trajectory, one can always tweak the vaccination program. That's one. Secondly, we need to go out and see who could be the right partner in terms of ramping up the vaccination drive. For example, we can draw upon our experiences from polio eradication program, where organizations like Rotary or Lions Club, they join hands. So it's not only just the public hospitals run by the government machinery or the private hospitals who are in the game now, but there also is a great deal of role to be played by the community-based organizations who can also help ramping up the speed of vaccination. So yes, we need to be able to read where the surge is going to happen, and that is going to get guided by the not only mobility but also the gathering which is going to happen. So be it a shopping mall, be it a school, be it a college, we should be able to preempt, and then we need to have our intervention programs in place. So preempting and outsmarting or outwitting the virus is the need of the hour. And so what we need to do, and a very innovative campaign, not only around vaccination, because behavior is such an issue that it's difficult to sustain. So it's a change in behavior. So what could be innovative behavior change or behavior change communication strategy, where people, of course, have been fatigued. It has been more than a year or so. We have been talking about using masks and hand hygiene and physical distancing during social interactions. So there is a bit of fatigue in terms of prevention practices. So what could be much more interesting? So the socio-behavioral scientists need to come into play, and mostly I would say the community engagement in terms of the folk artists or locally active groups who have not only in polio, of course, the mothers of the children who got afflicted by polio were the agents for social change. So COVID survivors can play a big role. And lastly, I would say that the folk artists, they played a phenomenal role in HIV/AIDS, because HIV/AIDS is another issue where behavior change communication was so very important. So I'm touching upon four things, basically. Read the epidemic well. So knowing the epidemic at the local level, at the district level is one thing, which is very important, and then designing the intervention program accordingly. Second is, how do we do innovative behavior change communication? Thirdly, how do we engage with the community-based organizations for ramping up the vaccination drive? And fourth, how quickly we can reach out to people so that there are multiple barriers of prevention by which the chain of transmission of the virus gets broken. These are the four key issues which appear to me as the need of the hour.
Definitely, that is aptly summed up there, Dr. Samiran Panda. Tailor-made preventive and intervention strategies required there on the ground, something which the agencies involved are working on. Thank you so much, Dr. Panda, as well as Professor Lakshmi, for sharing your views and insights on this very important issue. As our panelists were pointing out, as far as the recent surge or the spike in COVID-19 cases in certain states is concerned, those are the main reasons. The main among them is obviously not adhering to the COVID-appropriate behavior. And as our panelists were pointing out, let us remind you once again before we leave that the COVID-appropriate behavior is the best way forward, and it is a simple three-step process. One is that you have to wear your mask at all times in public places. Also, ensure that you practice hand hygiene, wash your hands very regularly, and maintain a physical distancing of at least 6 feet while you're in public domain out there. These three simple steps will go a long way in keeping you and your near and dear ones safe and secure. We'll come back again tomorrow with a different aspect of India's fight against COVID-19. Till then, keep watching Sunset Television. Thank you.